Today we're going to talk about the airway trolley. So in every operating theatre we have a trolley with all our airway equipment on it, and this is what they look like in our hospital, and they're very similar in most others. Noreen is going to show us the trolley today. She's one of our anaesthetic nurses. So the items that we have on the top. These are called eye protectors or cornea protectors. So there's lots of different ways of protecting the eyes, and we want to keep them taped shut. This is one of the devices we can use, or we can use very soft paper tape. The other thing we have here are eye pads. So if there's any concern about the patient's eyes being covered up or potentially having pressure put on them by somebody not knowing where the patient is underneath the drapes, we must protect and pad the eyes. Whenever we give an anaesthetic, we take away the patient's ability to protect themselves and to move themselves and protect from nerve injuries, damage like that. So we must protect them, seeing as we've taken that away. The other item we have here is just swabs. They're often quite needed. The airway can be a messy place at times, so we have little green swabs. These are the ECG dots that the patient is going to have on with all the rest of their monitors. These are the oropharyngeal airways that we went through in our oxygenation or oxygen delivery equipment, and we have various sizes that are always available to us on the trolley. So we typically use the green, the orange, or the red, so that's why we have them out here. If you're in a paediatric theatre, they'll be smaller, of course. Now, we typically have 2 laryngoscopes out on our trolleys with 2 different size blades. So this is a laryngoscope handle with a size 4, a Macintosh size 4 blade. The Macintosh blade is curved, as you can see here. When Noreen clicks it together, the light comes on at the end of it. So this is a size 3 blade, and you can see that the blade clicks onto the laryngoscope handle. And once she turns it on, this is a Mach 3, you can see the light starts to come out from the end of it. The blade has a little shelf on it, which when you're in theatre, we'll show you the purpose of that. It's mainly to lift the tongue out of the way when you're manipulating the airway. Now, we have bougies here. Bougies are big, long, elastic or soft, supple tubes that we use if we're having difficulty with an airway. We always keep them nearby whenever we're doing laryngoscopy, just in case needed. We have various different types of tape. Tape is really important because it keeps our tubes in place once they're put in, otherwise they'd just be swinging in the breeze, so it's really important. And we also have paper tape here that sometimes is used for the eyelids. Now, in the various trolleys, or various drawers of the trolley, I should say. So we have lubrication. All the tubes need to be lubricated before they're passed into the airway so that they cause little or no bleeding. Lots of different types of tapes there. Sometimes, particularly with people with alternative facial anatomy or beards, we use ties, these nice cotton ties, instead of tape to keep the tubes in the airway. So a tape won't stick to someone's face if they've got a beard or stubble, so we use our tape instead. These are called, we call them goosenecks, so you can see that they're little accordion parts of the airway, so that allows us to manipulate the location of the airway. Once it's placed inside the patient, we can move around where the tubing is located. So there's all our blades. Now, very important is our face masks. Different sizes of face masks available, commonly size 4, 5 and 6. Again, with paediatrics we have much smaller face masks available, but for all our adult theatres, size 4, 5 and 6 is typically sufficient. Next then we have our endotracheal tubes, lots of different sizes. So we typically use size 7, 7.5 or 8, and that covers most of our adult patients. Now, what also Noreen is showing you here is what we call a ray tube. This is a south-facing ray tube, meaning that when you place that into the patient, it will hang downwards from their lip. And we also have north-facing tubes, so when you put them in, it moves up over their nose and up over their face. And that depends on where the surgeons are working. So we've options for straight tubes, south-facing tubes, north-facing tubes, or these reinforced tubes. These reinforced tubes have a wire through them, so all those black lines is a wire that's running all the way through the tube, and that means it can be bent in multiple directions and out of the way of the surgeons or wherever the surgical field is. This next device that Noreen is showing us is a stylet. This is a metal, like a little metal rod that we can bend. So it's placed inside the endotracheal tube, and we can then bend the tube into whatever shape we want in, and it helps hold it in that shape. So if someone again has alternative anatomy, a difficult airway, we can put a stylet inside a tube and make it whatever shape we need when we're passing it into the airway. Now again, I went through nasopharyngeal airways in a previous video, but we see we have a stash of different sizes of here, usually anything between size 5 and size 8, depending on the size of the patient's nose or airway. And then finally, all the way down the bottom, we have some extra material. So firstly, now see if we can see that. That's a laryngeal mask airway. So I might show you a little bit clearer there. It's a bit shiny. So a laryngeal mask airway. There we go, that's a bit better. So this is a mask that goes into the airway. So it's just like the mask you use on your face, but this nice squishy mask bit goes down into the airway and sits above the glottis in the esophagus. The air then comes down in through the tubing part and the patient is ventilated through here, down through the tube. Lovely squishy mask bit sits above the glottis. We do not use these in patients that are at risk of aspiration or vomiting or are having things like a laparoscopic surgery where they're blowing up the belly with carbon dioxide. There's different sizes available and there's different types of LMAs, laryngeal mask airways available, all depending on the size of the patient. Let's see what other goodies. Oh, there we go. So this is a different type of laryngeal mask airway, and this is called an iGel. This is a second generation. There's multiple generations depending on how advanced the airways are. So it tells you what size they are, what weight person they were normally suitable for. The iGels are different in that they're a little bit more firm and they have a little side port. So there's a little port all the way up the side of the LMA so that if someone was to regurgitate gastric contents, it comes up through that port and hopefully does not go down into the patient's lungs, which is very important. Now, this is another airway device we have here. This is called an air track. So rather than the regular laryngoscope that Noreen has already shown us, this is a guided video intubation. So these come in different sizes. When the patient is asleep, they're put down into the airway. This one comes with a little channel along the side that we load a tube into. So there's a tube already in this device when we put it into someone's airway. And then at the top, we can see that there's a little hole that we look down. So that provides us like a little microscope. So we can look all the way down through that and it amplifies or magnifies, I should say, the airway, and we can see the glottis and we can see as we push the tube off the little channel down the side of it down into the airway. So that's called an air track. There's multiple different types of laryngoscopes available, but the one that we showed you first is the most common, and that's an example of a video laryngoscope. Now, here we looked at these devices in our oxygen delivery video. This is a Venturi mask. So it's a simple face mask with a red Venturi device attached that delivers 40% oxygen through the oxygen tubing. And we commonly put our patients on these after they wake up from their anesthetic, either the 40% mask or regular nasal prong oxygen. What else have we got here? Suction tubing. Suction is essential when you put someone asleep, that they don't aspirate any of the contents from their own airway or from their mouth, saliva, etc. Always have suction available when we're giving an anaesthetic. And I think that's largely it. We have lots of other airway devices in our difficult airway trolley and our airway rescue trolley, which I'll show you pictures of at a different stage, but these are the common devices that we have in theatre when we're putting someone asleep.